It's recording.
Okay, we have a patient here, and we already numbed the toe. Everyone asks me this on my videos. How come this doesn't hurt? It's because I numbed the toe, okay? I put the numbing in about 5 minutes ago. This is a patient, as you can see, she's a frequent flyer, and you see that gross stuff when you squish it? That's pus, okay, right there. That's stuff that just came out. That's kind of pus infection. Everyone at YouTube likes those gross things. So, since this has happened usually once a year, she tries to trim it out, can't get it. You can see it's noticeably more swollen on one side, and it's painful. And so what we do is we kind of go in there, and all this nail, she tried to trim it out right there and didn't do a good job. And so I free it up on the top, and I free it up on the bottom right there. You okay?
Yeah, I'm just nervous.
Okay, yeah. It's not hurting her, okay? It's just nervous. And then what I do, there's two ways of doing it. I'm going to kind of do the other way today, because I always show you guys the same when I do these videos. This is kind of a flip technique, okay? It's a little bit grosser. So let me show you what it is, and then I'll do it. So one way is when I cut straight down with the blade. This is another way you can also do it, where you actually take a nail and you flip it up on top of the skin, like that. That's kind of gross. And then you cut through. Then what you do is you cut down. So another way of doing it is this way, where you kind of cut down like that. And so you flip it up. I don't normally do it this way, but I just want to show a different way, because everyone's tired of seeing the same videos. And so that's the piece that comes out with that little flip technique. You see that? Here. Yeah, that's how much was in there, okay? And then what I do is I just make sure I got everything else, because when you flip it, I don't want to miss anything in there. Is that okay?
Yeah.
Okay. And so I just make sure I got everything else out. And then I use this little curette just to make sure there's no other nails. Now, this patient, she's going to have to come back and do the permanent procedure. I usually don't like to do the permanent procedure when it's infected with that pus, because when I push the Q-tip in, it could seed a infection deeper. So that's why I get all this cleared out. We're going to give it a couple weeks, and you have to wait for the best part. The best part everyone likes about these videos is the dressing. Okay, and I'll explain why. So this one I put betadine on.
What's that piece? Oh, is that just skin?
That's a little bit of skin there, yeah. That's a little betadine we put on there. And then this patient, she was actually supposed to come in for a matrixectomy, and she couldn't because she had to go do hurricane relief. And I was asking, what is it? I'm not going to say where it's for because everyone will know. But so she couldn't come in, and this is what happens when you don't come in for your permanent procedure: is you get a recurrent ingrown toenail, and all that swelling. So, and kind of as a memory of that, I'm going to try to. I don't know how to draw. I know how to draw a tornado, but I'm going to do a hurricane here. So here's a hurricane. Comes down, because that's the reason she couldn't come in for her ingrown toenail.
That doesn't look like a hurricane.
So what does a hurricane look like? Come on.
Yeah, it looks exactly like that. I don't know what you're talking about.
What's that?